Okay. And Julie, is it okay? Slide change.
So where's my slide change button? That one.
Yeah. Is it black screen? Oh, you don't see this. You don't see the slide. Your screen sharing is paused. I don't know why. Okay, stop sharing. Okay, share. PowerPoint. Share. Is it okay now? And you can see the slide change. Okay, good. Thanks.
Excellent. We are getting there. So good afternoon. So I think I can cut my presentation quite short because we have heard so much in these wonderful presentations over the couple of days. So let me give some perspectives from the angle of a medical device manufacturer to this discussion, especially on this concept of using speech as a sensing modality. So as a Philips, we are working on different areas, and we are all in healthcare. We have three main kind of categories of products: diagnosis, treatment, which is mostly imaging systems. Then we have a connected care, which is most relevant for this, where we have patient monitoring, home monitoring, and services like that. And then finally, personal health, personal care applications, which are a little bit less relevant maybe in this context now. Yeah, so we like to look at the health as a kind of continuum. We are covering many different phases of the health journey of people. We have healthy living. We have all these kind of stages of being chronically ill, being in home treatment, being in a hospital, and we want to see that as a kind of one system. And when we are developing new products or services, we are usually trying to look at these four different dimensions of improvements. So we want to improve health outcomes. That's of course very important for medical devices. When we are developing new product, that's the goal, we improve that. But we also want to look at that from the angle of the patient and staff member. So we want to improve the experience of the patient and improve experience of the staff member. And finally, for the hospital level, reducing the cost of care. So these are the four basic dimensions that we actually literally will check for every work that we are doing, that are we checking these and are we seriously improving something here? Does it make sense to go forward? And in this domain of speech-based sensing, I think this kind of connected care area where we have telemedicine is maybe the most important, most interesting, at least the point where we started from. So that if you can use this type of setting where the person is at home and we have a nurse or clinician in contact with the patient, use this audio that we are recording for free in this setting and use that somehow to understand some other things about the health of that patient and what we are getting by asking questions or sensing some vitals using sensors. That would be very, very good. It actually touches three of these quadruple aims very easily. So we can see that it probably improves the health outcomes because we can more early detect that there is a condition changing in the patient. We can send that patient to kind of further examination. We improve the patient experience because the patient doesn't need to go to the hospital for checking, but during this call already we can do something. We can find something and track the patient health. And finally, of course, the cost of care. So travel and appointments, all this is reduced there. So in this setting, we can sense all kinds of things that we can imagine. We have heard many good examples of different sensing modalities and kind of targets that we can look at. Our own ESR worked on sensing the respiratory health of the patient. And when we look at this conversational setting, we can analyze the content of speech, the linguistic content, speech production related parameters, which contains muscular control and respiration, for example. We have paralinguistics, which offer links to cognitive, mental conditions of the person. We also have this entire conversational setting. What is the behavior of the person in the conversation? What is your turn-taking behavior, for example? That is something that can tell about your cognitive capabilities, your mental state, many things. And we can even use the speech of the other side, the other person, and sense from that what is the reaction of that person or kind of the attitude of that person towards the patient. So we can sense, so to speak, like some kind of a secondary measurements of the same target person. So these are all kind of sensing modalities, sensing kind of targets in the area, and we can indeed look at many of these things that we have seen in the previous presentations. What can be the targets of that? But still, looking at this kind of first bullet, the most important one, improve the health outcomes. How are we actually doing that? We are only sensing here in this setting. So this is not yet doing any intervention. We assume that we are giving this number, like that the respiratory health of the patient is reducing by a certain score. We can give that to the clinician, and the clinician can make a decision to have an intervention, sending someone over or inviting the patient for further examination. But that's basically what we can do. And technologically speaking, if you think about what is the product that we are selling here, it is a little piece of software in this call center system, basically. So that's not like super attractive if you talk to our marketing people, that we have a little kind of a additional processing module which gives one number to your dashboard. So that's not a big thing. And that's actually kind of the biggest challenge that, not biggest, but one of the challenges that we are looking at, that how we can make this intervention also part of the system. And we have seen wonderful examples of therapy systems that we have in this consortium that people have been working on. That is kind of one direction how to do that. But we want to see something that's how this measurement done on speech influences the performance of a medical device so that it improves these quadruple aims. And this is more challenging. We don't have very good examples of that, but one thing that we are looking at now, which is relating to work of Srikant, is related to respiratory support systems. So we have oxygen concentrators. This type of devices, you see this cable going to the nose, giving enriched air to the patient who has a chronic lung condition, COPD or some other disease. So this is something that you're using when you're kind of in a normal life. So this is like having fun with your grandchildren, wearing this device, which is actually quite bulky. So this is what you can do. But these people are talking, and we know that when you have oxygen flowing into your nose while you are talking, it's not super convenient and also not super efficient in terms of getting that oxygen in, because we know when we are talking, we are inhaling very quickly and we are exhaling while we are talking, because speech is controlled exhaling, like Srikant nicely said in his presentation. So therefore, if you can do something smart here, like being able to detect from the speech that when this person is going to inhale next, we can actually push the oxygen in when you are naturally inhaling while you are talking. And this is something that we actually demonstrated with Srikant's algorithm, that we can predict inhale moment like 1 second ahead pretty well. It's not as good as predicting the respiratory rate in his results, but it's still much better than chance. So it can actually help to improve the patient experience of using this device. And also, I would believe that it also reduces the cost and also reduces the size of this box eventually. So if you can make that more effective, that it really pushes the oxygen in when you need it, when you are inhaling, given your natural way of using your respiratory organ for speech. So this is kind of an example where we directly use the sensing from speech into something that is part of the medical device. And this is attractive because this is now concretely changing the device and the way it works and influencing these factors that we all see important. So this is our only example that I have. So we know audio is being recorded in many places in healthcare. We have all this dictation system that's very standard everywhere. So you can imagine that we can use this type of system for detecting stress or uncertainty about the results or something like that. So this is all, we have seen that type of work in speech sensing domain, also in ICU, stress, communication between the staff members, we can sense that type of things. But these are also a little bit like sensing things. So this is also a case from emergency care. So we also have audio recording possibility there. So these are still, I don't have concrete answers in these cases. I think there would be more places where we can use speech in an intelligent way to control a medical device, but we have to kind of dive deeper into that later. But anyway, this first start with this respiratory sensing, I think it's very good example where we believe we have something that we can work on, and we are happy to tell also that this is going on. So Srikant is continuing this work now as a staff member of Philips Research and starting a large data collection trial in India, and that's something that Srikant already showed in that presentation. Just made this should be a video. Okay, it doesn't seem to be playing so well now. Maybe it has not been completely sorted. But anyway, so this is ongoing in collaboration with the medical center in this area in the Kasturba in India, and there's several rural health centers where we are collecting speech and respiration data from about 1,000 people of different ages and background conditions. And this is hopefully going to push this technology that we developed together with Srikant on respiratory sensing to a higher technology readiness level, so that we can actually start thinking about how to integrate that into the products. So this is all that I had. Okay, thank you very much.
Thank you. Okay, sharing the view from the Philips research there. So we have next presentation in person. So we have one in-person presentation, and then we have 2 video presentations. So which will come after this. So we have the next talk coming from Oxford Wave Research. And Tom and Oscar are going to present that. Where is your,
I started it with OWR to try and help.
what is that?
I started it with OWR and
Yeah, it's easy to spot. I saw that. Yeah. Okay, I download that. Okay. Net. That. Okay. And then I go here. I stop the recording.